I read this book recently called The Gap and the Gain, and it's like about focusing on where you started and where you are versus like focusing on the ideal. And the ideal for me is Grapefruit Health. Like, we want to get to 1 million students and save millions of lives. Am I where I want to be eventually? No. But if I focus on where I really came from, yeah, I'm proud of that. I'm Eric Alvarez from Chicago, Illinois. I'm the CEO and proud founder of Grapefruit Health. We're really addressing the massive staffing shortage in healthcare today. My first company, I was 13 years old, did oil changes at people's homes. So I'd take a wagon with all my supplies, not a red Flyer, but like an actual kind of professional wagon. And in high school, college was never on the docket. My dad painted houses. My mom was like kind of a teacher's assistant, and joined the military. So I was in the Air Force. That gave me the discipline I needed to really take care of all those other things and gave me the drive really. So I got a whole bunch of education, including my master's degree in healthcare administration. Now I have the privilege to sit on faculty there today, and I work with tons of clinical and non-clinical students. And then in 2015, joined a startup as the chief operating officer and first employee. And we grew that over 5 years, and we were acquired by a very large electronic medical record company. And so it was really the convergence of those three experiences, healthcare education, healthcare administration, and healthcare entrepreneurship, that led to really Grapefruit Health coming to fruition. We're short by 3.2 million healthcare workers, which is the population of Los Angeles. And people are literally dying because they don't have access to healthcare, our most vulnerable populations. And so solutions out there today are things like recruiters and travel nurses and staffing platforms. But the problem is that they're just moving a finite amount of resources around and driving transitions of employment and charging a premium to do so. So they're driving up costs and reducing productivity. At Grapefruit Health, what we're doing is creating the first national workforce composed only of and completely of clinical students that we recruit, train, and manage onto our technology platform so they can perform work for healthcare organizations remotely. There are 1 million students pursuing clinical education today, from medical assistants to nursing students to social work, pharmacy. So it's the opportunity to create 1 billion new patient touch points every single year. We've had a lot of trial and error and experimentation, and we have a long way to go. But I think when we do this right, it's a win-win-win. The students get to learn while they earn, patients now get the care they desperately need, and healthcare organizations can do what they need to do for less. What we're doing is like absolutely critical. Like, it's gonna save millions of lives. It's not a nice to have. Like, this is a real opportunity to make a real impact for a lot of people. And so I think just because the problem is so significant, and that I think we have a real solution that we've tested and proven that it works, by investing in us, it allows us the runway to do the experiments that we need to build, measure, and learn for this to become a scalable business. And so instead of will this work or not kind of investment, I think for us it's more, can we do more with this money? My dad's from Puerto Rico. We didn't have a lot of anything growing up, kind of paycheck to paycheck. And so to come from there to where I'm at now is recently named like Alumni of the Year, and I've got to do some really cool things. I want to continue to be proud. And I think the way for me to do that is to achieve success with Grapefruit Health.